It's all yours. Good luck with it. Thank you. Hey everyone, welcome to the current and emerging threats facing the health sector in 2025 this year. My name is Ethan Muntz. I am with Health-ISAC. Really excited to be a part of this conference this year. Perfect. All right. So we were talking. So how many of you were at the keynote this morning? All right, good crowd, good crowd. So he was talking about the information sharing and analysis centers. So we are that, but for healthcare. So the Health-ISAC is short for information sharing and analysis. What it is, we provide a protected forum. So, for example, we have two people in the same industry, just for reference, like maybe United Healthcare and Pfizer. Normally they wouldn't talk to each other because they're kind of in a similar industry that compete. Maybe a more accurate example would be like, Pfizer and J&J, two random pharmaceutical companies. But what Health-ISAC can do is we provide a protected space for their analysts to discuss security and vet information. So we have this unique insight by hearing all these analysts talk to each other through our platform about what people are seeing in the health sector, kind of what is top of mind, what is more impactful, because a lot of times when we read cybersecurity reporting, it's like, okay, this is an event that, say like the F5 breach. It's got a lot of customers, so it must be impactful, but the ISAC can help understand what our members are actually going through and seeing. And that's what directs our intelligence analysis efforts based off of what the community says. So it's all community driven. There's ISACs for basically every sector, critical infrastructure. So we are at over 10,000 security analysts in our community right now. Some of the benefits that we have are, threat intelligence, automation, and then like I'm talking about some of the community peer-to-peer sharing services.
So I can wait until the end.
No, it's good.
The 10,000, is that what makes up the analysts within the industry entities?
So that 10,000 is the number of security analysts. So it's not 10,000 organizations, but rather the amount of analysts
within those organizations.
Yes, I think last year was a big milestone. We hit over 1,000 organizations in a global network. So it's also global. It's not just in the U.S. So we get different perspective, like Europe and Asia.
May I ask another question? How do you overcome the language barrier?
So a lot of people speak English, and we don't really have a large enough presence abroad to where we've had demand for multi-language platforms.
Right.
English has kind of been sufficient for what we're at. But I do want to mention that we're not just a cybersecurity shop, we're an all-source security shop. So we have physical security, we have cyber threat intelligence, and we have strategic intelligence. So I fall under the strategic intelligence vertical, so I got my hands in a little bit of everything. So this is some of the stuff we have for physical security. We have our daily physical report. We have some SAM collaboration. But now we're going to get into the nitty-gritty of this presentation. So to start off, I always like to bring up this slide before we get into a presentation to just kind of take a look at this. This is the scale from kind of least impactful to most impactful on the cyber threat spectrum. So hacktivism, these are your politically motivated hackers. They're often script kiddies. They use distributed denial of service, so they try to flood servers or deface websites. Moving on, we have crime. Some of the talks earlier today, in this room, there was a big talk about ransomware, and that kind of shows the pinnacle of cybercrime sophistication. But there's a lot of other ones like initial access brokers, social engineering. Like these things aren't necessarily as sophisticated or impactful as say maybe a ransomware attack would be. So crime in itself is a spectrum, but it kind of falls above activism, kind of on the lesser end of the threats holistically. Moving on, we have insider threats. So these are people that already have trust and privilege within the organization they intend to target. So they're a lot harder to detect and can often know how to position their attack to make it more impactful. Moving on, we got espionage. So this is going to be your nation state, like your Russia's equivalent of the CIA, their SVR, FSB, or their military intelligence, the GRU. These are some nation state threat actors that have done espionage. Salt Typhoon, Volt Typhoon, if any of y'all heard of that, the Chinese nation state campaign to free position in critical infrastructure networks. That would be an example of this espionage. Moving on to terrorism. So this is just like blowing up the computer. And then warfare. So like maybe a critical data center was in Ukraine and it got in the crossfire between Russia and Ukraine, and now it's completely in operation. So just keep that in the back of your mind as we go through this presentation. So here's how we're going to structure it out. We're going to start with recent attacks against healthcare. Moving on, we're going to talk about the current threat landscape. Then we're going to talk about notable tactics and techniques. Then we're going to wrap it up with a bit of forward-facing reporting. So before I start, anyone have any comments? All right. So recent attacks against healthcare. So we can break these into three sections. The 2025, it wasn't as directly impactful as 2024. So 2024, I'm going to go over some key events that happened. As you can see, number 3, the spoiler. But starting off, we're going to talk about some TPDs that we saw that were a bit concerning. So patient extortion. In the ransomware attack, the ransomware actors have to have a way to extort money from their victims. And a lot of times organizations aren't paying. If you look at the statistics, they're not paying as much as they used to. The average ransomware payment is a lot lower than it was in the days of the Colonial Pipeline and Dark Side. So to kind of get this money, when all these organizations aren't willing to pay, threat actors are reaching out to individual patients and saying, hey, for a smaller sum of money, we'll delete your individual entry from our data set, whatever they call it, the data that they stole from the health sector organization. So it broadens the scope, and it also brings the impact directly to the patients, which makes it a concerning shift in TTPs from a healthcare perspective. And then to make this even worse, this is a really troubling example that happened in 2024. A plastic surgery institution was hit with a ransomware attack with Black Hat, and being plastic surgery, they had mammogram images. So they had images like pre-op images of patients. So they were essentially using those pre-op images in a sextortion scam to target these individual patients, saying, hey, if you don't give us, $50, we're going to leak this embarrassing photo of you before your operation, which is a huge breach of HIPAA, huge, they have access to PHI, and it's kind of the most damning example that we've seen of patient extortion. But it just goes to show that nothing's off the table for these people. So it really is, back against the wall. They're willing to go there. So as a community, we have to come together to build our collective strength, and operating out of silos, like just one organization and not sharing security event information. When we're up against threats like this, it's kind of critical that we kind of talk about what we're seeing. So this is something that happened again in 2024, but third-party risk. As I know that's a big phrase over at Health-ISAC, kind of in our internal talks, but supply chain. So the health sector, and I'm sure a lot of other critical infrastructure, a lot of other sectors of industry, you have unique supply chains where you have things that can't be easily replaced. So these are called mission critical suppliers. That's the term that when Health-ISAC, we partnered with the American Hospital Association, AHA, to look into this string of ransomware attacks against blood suppliers, because blood suppliers, they fit our definition. They were key to the mission to providing care to patients. They weren't easily, once one went down, there's not a readily available alternative. And downtime translated to directly into patient care disruption, which makes it really critical in health sector guys. So in 2024, the blood supplier One Blood, who is kind of down by us, if you've seen those red buses, Synovus and Optipharma, which are both in the UK, they faced a ransomware attack which brought their electronic systems down, which meant they had to use pen and pencil to categorize the blood samples, and that took too much time. So by the time they were doing that, there was a ton of blood that was lost. Wasn't usable anymore because they couldn't categorize it fast enough. And then when people needed it, like EMS needed it, they had no efficient way to look it up because the systems were down over what blood was available. And 1 year later, after all this, I read an article the other day that the NHS, the National Health Service in the UK, is still looking for donors to fill the blood shortage that was caused by this ransomware attack, where they hit Octapharma and Synovus. And then speaking of critical suppliers, it's not just medical. It's not just a niche product in your industry. Like for healthcare, it's not just blood or medical devices or syringes. It's also software. So when you have a critical piece of software like the Change Healthcare Insurance Care Authorization Portal, it's when patients were getting care and they needed to expense that to insurance, that portal where their care provider would authorize that treatment, that was shut down in a ransomware attack. And that impacted a ton of pharmacies. It was a nationwide outage. I think estimates say 63 million patients were impacted because people couldn't expense care. They couldn't expense prescriptions. So pharmacies had a big problem, and life-changing or like life-altering surgeries had to be postponed until that stuff could be authorized. So we saw a massive patient impact with this ransomware. So it goes to show that cyber threats don't just exist online. They don't just exist on our computer screens. They translate into the physical world, and especially in healthcare, we're acutely aware of the impact that this could have on actual people. And that's what really spurs this, at least in my career. I feel the sense of fulfillment because I feel like I'm protecting people because when they go into the hospital, when they go to get treatment. So that was a intro to kind of the big events that we have seen in the past. So moving on, we're going to talk about what's going on now. What is the big thing, 2025? Where do we go from here? So we're going to talk about some cyber criminal activity, significant takedowns. This one's kind of my favorite because reading through all this, I can get a bit depressed, seeing how we got every organization's getting hit, ransomware's being deployed. These people are getting away with it, but I'm here to tell you that they're not. They're not all getting away with it. Nation state, geopolitical, and then we're going to wrap it up with some medical device. So cyber criminal activity. XC Kills was a backdoor that was found in, I think it was it was a Linux distribution and almost made it to production. But it just goes to show that patch management and kind of testing the patches before you roll them out is critical. And then group Retel. How do we start this off? Got an idea. Raise your hand. How many of y'all heard of Cobalt Strike? C2 pen testing framework. All right, good chunk of you. So Cobalt Strike has been around for a long time. For those of you who may not know, Cobalt Strike is a command and control C2 framework used by legitimate pen testers to simulate adversarial attacks. And what was happening is cyber criminals were getting cracked copies, so unauthorized instances of Cobalt Strike. And they were using Cobalt Strike in their campaigns against health sector organizations. And Cobalt Strike, we partnered with them and Microsoft to kind of revoke access to identify these cracked infrastructure instances and revoke criminal access. So kind of get those bad instances off the street, if you will. But to fill that gap, there's been a new tool, Group Retel, which I'm going to start this off. Group Retel is not malicious by nature. It's a pen testing tool. It's legitimate. It's the same business model as Cobalt Strike. It's used by pen testing teams, but it has the same functionality, where it's a C2 framework. But Group Retel has been seen kind of being used as a replacement in threat actor circles from criminals who obtained it illegally. And so they're using it to attack health sector organizations. So we're kind of seeing it replace what Cobalt Strike used to be. We're seeing Group Retel kind of take that mantle. And then, so cyber criminal takedowns. So for those who were at the talk earlier today in this room, where we talked about law enforcement activity going against Lockbit, that was Operation Kronos. While this, and a lot of these are joint operations, many of them are actually led by Europol. Europol is extremely active. That's the EU's collective law enforcement agency. They're very active in kind of this cybercrime space. So Operation Kronos was major law enforcement against Lockbit, and we saw that following decrease. Health-ISAC observed that as well. In Operation Endgame was same thing, but it was against malware as a service. So just like ransomware as a service, where you have affiliates use the ransomware, the client portal, the social engineering kits that are created by a bunch of malware developers. Malware as a service offers a similar listing where you can use like an info stealer malware that is maintained by a software development team, a criminal software development team, but is leased out to these hacking teams called affiliates that they use in their operations, which then the platform takes a percent of the profit, and that's kind of how the business model operates. Operation Morpheus was an expansion on taking down Cobalt Strike instances. And then last year was Operation Magnus, which targeted Redline and Meta info stealers. An info stealer is malware that once downloaded will take the information that's stored in your browser. So cookies, session IDs, credentials. So it's definitely prudent to use a password manager so those passwords aren't stored locally in your browser. Notable ransomware actors. So Health-ISAC, we're kind of unique in the intel space where our scope is so broad, we can go for the whole sector. So it's not just for one organization, but we're looking at the health sector as a whole. So we maintain a database of ransomware events targeting the health sector with the health sector victims. So like if a health sector organization gets hit, we file it, it's in our database. So looking back at the end of each year, we look through our proprietary data set and we're like, all right, which are the top 5 most impactful? There's a big one missing. Lockbit, nowhere to be found, not in 2025. Saw your hand up?
Just for definition's sake,
Sure.
when you say impactful, is that money's gained or?
That's a great question. It's the victims accrued. So in the health sector, it's the amount of health organizations they have listed on their data leak site in the given year. We have, like outside of checking in, where we say, hey, are you good? What happened? We have no way to verify whether or not these attacks went all the way through,
Right.
and there was that data exfiltration.
Right.
So we just go off of data leak sites and their listings. So each one of these ranked in order top 1 to 5 have the most health sector victims in 2025. So for 2024 and 2023, Lockbit was in that top spot. Lockbit was the king of the healthcare criminal ecosystem. But since that law enforcement action, we haven't observed an instance in 2025 at all. So now that power vacuum, some new actors are taking hold. So QLink, this is, despite their name, they're actually a Russian-speaking cybercriminal group, followed by Ink Ransomware, followed by Lien, Ransom Hub, and Medusa. Recently, the number 5 spot has gone to an organization that calls themselves SafePay. But this is our top 5 listing to show which ransomware as a service platforms are going after healthcare.
I'm sorry, I'm trying to harangue you. From geographically speaking, is that primarily China and Russia?
I like where your head's at, but Huelin, you would think that is Chinese because that is Pinyin, which is the phonetic pronunciation of Mandarin, but it's actually Russian speaking. So despite their name, like if you were to look at the way that they talk to each other and the ads that they post on their data leak sites, it's all in Russian.
But these 5, what's the primary geography?
Ooh. I think they're all Russian, for all my honesty. The only one I'm not sure about is Lien, but I'm like 90% that it's Russian speaking, but I haven't looked it up in a while. But Russia tends to dominate this space, or at least Russian speaking. Where they're actually from is hard to pinpoint, but the language that they speak is Russian.
Thank you.
Nation state activity. So 2024, we saw this wine loader campaign. APT 29 is out of Russia. So they were using wine loader to target EU companies, so healthcare and pharmaceuticals. This UTA 0178 was the Chinese nation state campaign. They were targeting Avanti edge devices. And then this guy, this has been a thorn in our side the entire year of 2025. So to give some context about why this keeps popping up. At the end of every month, Health-ISAC, we meet with a select group of members called the Threat Intelligence Committee. These are members that are especially active in our community, and they kind of act as like an advisory board to see which events in the criminal landscape are worth investigating, which ones are more prudent than others. And we distill 5 events every month and have a monthly threat level. So in 2025, at every single monthly threat level discussion, at every single threat intelligence community discussion, this DPRK remote worker IT fraud has been consistently reported by our members as saying this is something we're dealing with. And for those who may not know, North Korean, there's this campaign right now where we call it a nation state campaign because anyone operating outside of North Korea on behalf of the North Korean government probably has permission to do so and are working for the government. So because they wouldn't allow a standard North Korean citizen just to work abroad, it's more than likely state sanctioned. So what they're doing is they're applying to remote positions in mass and collecting salaries, and they take those salaries and send them back to North Korea for weapons development or whatever North Korea does with their money. North Korea, when compared to the other big 4 adversarial nations for cybercrime, that's Iran, Russia, China, and North Korea. They are the most direct because they don't really have any international trade partners. So to make their money, they use cybercrime. They hit the big cryptocurrency exchanges. They are one of the few nation states that do conduct ransomware campaigns. But this campaign is they're using deepfakes or other AI technology, or sometimes Western individuals will like lend out their LinkedIn accounts to let these North Korean operatives apply to jobs. And then once the technical interview ensues, once you're at that stage of the hiring process, North Koreans, the way that they're trained, if you show an aptitude for STEM in North Korea when you're a kid, you get pulled out of primary and they put you in this whole separate track to become a cyber warrior. So basically from middle school up into university level, you're trained separately as a team to do cybercrime. And then you're trained at the best universities in China right after you graduate, and then you work for the North Korean government. So they ace these technical interviews. They're extremely sophisticated. So companies want to hire them, but they think they're hiring these people that, they might be in Malaysia or they might be in India, but they're really hiring someone from North Korea. And they're using overemployment. So these people might hold 2 to 3 jobs at a time. They do the job, they collect the money to send it back to North Korea. And we're seeing in the Health-ISAC community, our members, they've had some applicants from this campaign try to get employment at their job. There's some warning signs, like people never turn their camera on. When you go to ship them a laptop, they suddenly want it to go to a different location. There's some other stuff there, but this is being consistently seen in the health sector. So geopolitical, this is something that is kind of hard to tie to healthcare sometimes. We can read stuff on the news about how like Israel, Iran, that war popped off, or Russia, Ukraine. And the immediate thought is like, oh, if you're Ukraine, you're in big trouble because there's all these war zones going on. But in the cyber landscape, it's a different ballgame because there are no borders on the internet. So these political conflicts, they act as an avenue, like a catalyst for cybercrime, for hacktivism, and then cyber criminals that pretend to be hacktivists. There's a lot of blurred lines there, but it can really spur some criminal activity. And what we saw in the Israel-Iran war, when it really popped off with Iran, there were a lot of hacktivist groups that started targeting Israeli critical infrastructure. So when a big war happens and a threat actor wants to target a country, they will target that country's critical infrastructure instead of the government. They'll target that whole critical infrastructure base. And the health sector is part of that critical infrastructure base. So cyber Islamic resistance, this was a pro-Iranian hacktivist group. And to illustrate that point, they DDoS 9 Israeli hospitals, including children's hospitals, trauma center, and mental health. So, like I said before, these guys will go there. They don't have that moral guard post that says, hey, we shouldn't target healthcare. They're willing to do these disgusting things. We also saw some people from Russia, a group called Server Killers, also targeted Israeli hospitals. And then avenues for continued escalation. If there are more missile strikes on countries like Qatar or countries that are kind of out of band of the Israel-Iran beef, the current ceasefire seems to be holding. So there likely isn't as large of a continued risk for escalation now as there used to be, but it's still something to look out for given the tensions in the region are high. So moving on, medical device security. We had we did this research project where we took medical device advisories, so the industrial control systems medical advisories, the ICS-MAs. These are distributed by CISA, and we cross-reference these vulnerabilities with the known exploited vulnerabilities to see which vulnerabilities in medical devices are actually being exploited by threat actors to kind of prioritize vulnerability management. And we found 12 devices from 5 manufacturers that had known exploited vulnerabilities within those products. Notable TTPs. So this is kind of from a strategic intelligence. I like the big data sets. So this is some of my favorite stuff. Starting off, kind of broad stroke tactics. Help desk targeting. This is consistent across the multiple years we've been doing analysis on this stuff. Help desk emails are public facing. They're external. They're easy to find. Threat actors, it's a super low commitment. You can just shoot off a phishing email. But we're seeing a lot of help desks being targeted because those emails are public facing and public facing inboxes. QR code phishing. Now it's called phishing. That's the fun new word. But because it's an image, it's not flagged as a malicious link on your email security product. So it's getting through. It's getting through the gates. So, and people also, when you see an image, you take out your personal device to scan it, and now all of a sudden the activity's on iPhone, an unmonitored device that the organization has no visibility into. You could social engineer me to, put some PowerShell command. And speaking of PowerShell, quick fix. Its new thing is, oh no, your computer, verify you're human. Paste this thing into your Windows Run dialog to show that you're human. It's an obfuscated PowerShell campaign, and then you get hit with a one-liner, and they can do a bunch of actions on objectives after the fact. So notable malware that we're seeing targeting member organizations. Health-ISAC, we have an IOC sharing channel, so indicators of compromise that members share with other members. And in that list, we were able to distill the top 5 pieces or top 5 malware families that kept being shared. And this is by indicator volume, so the amount of indicators distributed per families. And these were the most prevalent that we found. Xworm, NJRat, NetSupportRat, AsicRat, SockGolish. So Xworm and SockGolish are like loaders. They load additional malware. They can do their own things, but they can also load additional malware onto the system. NJRat, NetSupportRat, AsicRat, these are remote access Trojans. So they are designed to look like legitimate software. In the case of NetSupportRat, it's designed to look like a product called NetSupport, but it's a Trojanized version that gives threat actors control. It can also do another, like it can steal stored credentials and stuff like that on victim networks. So new for 2025, Health-ISAC has been taking the indicators that we've observed, and based off of what the member says, like, oh, we saw this in email, we append a MITRE TTP code to it. So the MITRE attack framework, it's like a dictionary of different techniques that attackers can use. So it's a good way that for security teams to talk to each other. So instead of saying PowerShell, we can say T1059. That way we all know what we're talking about. Or like this one right here, it's a good way to share. But these were the top 5 attack techniques that we observed in our indicators of compromising data set. So this is what's impacting our members. Because like I said before, all of that data is shared from our membership. So this is all observed in healthcare from healthcare organizations. So I think that gives it some additional relevance when we're discussing healthcare cybersecurity. So PowerShell is a big one, malicious link, and then malicious T104.004. There's some malicious copy paste going on in there. Like we were talking about pasting things into the Windows Run dialog. If a user in your organization does not need access to the Windows Run dialog or PowerShell, be a good way to mitigate that full click fix thing is to disable PowerShell, to disable that Windows Run dialog if you can.
Another quick question.
Of course.
Does your constituency talk in the MITRE ATT&CK framework terms? Or
I wish. I actually did. We at our threat operations center contextualize,
Thanks.
and we'll get based off the information they provide us. So this is kind of the extended version, but it goes to show kind of the prevalence of certain techniques versus others in our data set. So as you can see, we have the PowerShell that's really high. This malicious link disproportionately high compared to these other methods. But we're also seeing, spear phishing with an attachment, password spraying. But kind of our top 5 are really the ones to look at because the rest are removed. And that's kind of what this graph is showing. That certain MITRE techniques are favored more than others. Moving on to vulnerabilities and exposures. So Health-ISAC, we have a targeted alert program where we work with third-party intelligence vendors. We do not scan member networks ourselves. These intelligence vendors use passive scanning, and when they give us alerts based off of members that may have vulnerable software or vulnerable products. And so then Health-ISAC says, hey, we got notified that your organization had a dangling DNS record here. Dangling DNS is this. So based off of our data set for this year, these were the top 5. These were the top 5 threats that had the most targeted alerts sent out about them. So we had the most sent out for dangling DNS, which are unclaimed subdomains. These are abandoned DNS records that are legitimately owned by an organization, but they haven't removed yet. So that can pose some serious risk for that organization because threat actors can find those. Beyond Trust, these 2 vulnerabilities in the Beyond Trust platform allowed for unauthenticated remote code execution. So that's CVE 2024 12356 and CVE 2024 12686 respectively. But those 2 vulnerabilities were our second most prevalent target, the thing we alerted on the second most times. CEO doxing. So in the wake of the Luigi Mangione assassination, we have seen threat actors online that are campaigning to dox CEOs. So posting their names, their addresses, their phone numbers, their families' names in a way to intimidate them. So we alerted, that was our third most alerted one. This is 4.OS. Next.js, that was our last one. And then RDP, that was our last vulnerability, was this Next.js one. And then remote desktop protocol exposures. So there were members that had port 3389 or remote desktop that was publicly accessible, it was open. So we reported on that and said, hey, just take a look. This IP has this port open. You might want to remediate that. So those are our top 5 things that we alerted on for our membership.
And the public-facing vulnerabilities, how were those captured?
Showdown.
Okay.
So we use third party. I don't know what tools they use, but I would equate it to Showdown where it does passive scanning based off of like versioning.
Okay.
That would be my best guess. But we are not doing any form of pen testing. We don't do red teaming at Health-ISAC. It's passive. And we do it through a third party. So going into the future, kind of what's next? The Europeans are ahead of the game on this. They really do a lot of forward-facing reporting. So they had a threat landscape report for 2024. It kind of showed there was a bunch of QR code attacks and that AI is being used nearly everywhere. Furthering this, they had this 2024 Internet Organized Crime Threat Assessment, or IOTA, it's their acronym. But it's a deep dive into like the cyber criminal landscape, like these organized cyber crime actors that we're discussing, like the ransomware groups, malware as a service platforms, malware developers, botnet owners, kind of the more sophisticated side of the house. And it showed a clear trend that AI is being put in everything. So it's not just your ransomware, it's not just your social engineering, but any kind of crime you can think of, like fraud. It's being used in fraud. It's being used just about everywhere. So AI is here to stay, unfortunately, in the cyber criminal space. Speaking of AI, MITRE Atlas. This is a new framework that MITRE has put out recently. So they're trying to do the attack framework for AI attacks. They're calling it Atlas. So if you're ever curious about attacks on AI systems or AI-enabled attacks, MITRE Atlas is a good resource. Under each tactic, there are cited examples. And if you want to contextualize, if you're doing security reporting and you want to find an instance of a certain AI attack, I always check MITRE Atlas and then I go to the references. And it's a great place to find security information about these AI attacks that may have gone underreported. So speaking of MITRE, OpenAI and Microsoft, they led this campaign to disrupt ChatGPT access by nation-state actors. And it was the first incident back in the day where these AI-enabled TTPs were actually attributed to nation states, saying like Iranian nation-state actors did this, or Chinese nation-state actors did that. But some of the ones that kept coming up over and over and over again were LLM-informed reconnaissance, LLM-enhanced scripting, and LLM-supported social engineering. The only one that kind of isn't what it sounds like is this guy. So LLM-informed reconnaissance, it's not really having it teach you how to do a port scan. It's more of like, hey, this company or this medical device uses this obscure protocol to communicate. Can you explain this protocol in a simple way so I can understand it? So it's taking complex information and making it digestible and kind of lowering that barrier to entry for threat actors. NIS2, so this is kind of another information sharing directive, but over in Europe, been a big thing for our European members, trying to bring critical infrastructure owners together to come up with security programs and kind of in-source the best practices. So it's not just like we're in silos and we're relying on, a different set of best practices, but to come together because the internet doesn't have any walls. So it's kind of crucial that information sharing and that we come together as a sector to overhaul these threats. So I'm going to wrap that up here, go into questions and answers. These are some free resources that we have. We have the our annual threat report for 2024 to 2025 is right here. The big lengthy for you folks that like tech docs, 405D from HHS or the Department of Health and Human Services in the government. They give some great recommendations on how to harden healthcare cybersecurity systems. And I'm happy to take any questions.
I have a question for you.
Yes.
When it comes to medical devices, or should I say, speaking from the lens of medical devices, do you foresee that there is a reporting agency that would handle incidents that happen to the medical device, such as worm outbreaks, ransomware that gets on a medical device, anything like that? Because I got to tell you, I've been doing this for a long time. I haven't seen anywhere that's even collected.
That's a great question. And I hate to be the bearer of bad news, but I don't think that there is one. I think the only way that you could see it would be when someone has to report that they got hit to the HHS OCR, which is if a healthcare organization has a data breach, they have to report it to the OCR. There's a list of healthcare organizations that had data that suffered the data breach. They have to report that to the government. That would be the only list I could think of. But there are, for what we use at Health-ISAC, a lot of vendors, if you know like which medical device manufacturers are being used in your environment, they'll put out product security advisories. So that's kind of what we look at, is we look at medical device manufacturer product security advisories, or if you have a third-party intelligence tool like an RSS feed or something, you can go on, have it look for stuff on like NVD and have it query medical device keywords. So like Philips or DICOM Like, and then if vulnerabilities are associated with that, you'll get alerted that way as well.
The FDA is doing stuff now as well.
The which one?
The FDA
Oh, that's
is
cool.
getting really involved in it as well and creating alerts on it.
Oh,
So
awesome.
you can actually sign up for free alerts for any medical devices.
I think.
Yeah, certain medical devices have to be like quantified by FDA.
I think the only database that I found that is actually very true and says this incident happened and this is how it happened. It's out of Europe and I don't have it offhand, but it doesn't show any incidents that have happened in the US. And there have been incidents in the US.
I have a business card. I can talk to the medical device folks and see what they would say. I'd love to connect with you offline.
Absolutely, I welcome that. Thank you.
Of course, of course. Anyone else have any questions about this presentation?
How many threats are coming from inside employees in healthcare
Um,
organizations?
I would say that it's significant. I wouldn't say that it's like the largest thing, but Health-ISAC, we have a special working group. We have an insider threat working group that's TLP red. So we use TLP, it's like a pseudo classification system, so it's not, confidential, secret, top secret. It's kind of private, but TLP red is the highest that we have. And there's a couple members in there, they take it very seriously, especially at these larger organizations. With I think the big unifier is healthcare organizations that have a huge R&D presence. Because China is trying to get ahead in the biotech game. And one of the classic things of espionage is if you can turn a disgruntled employee to give you intellectual property, that's a pretty common espionage tactic. So being on the lookout for people, especially in the R&D section, that would have access to those trade secrets, that's where an insider threat risk would really be prevalent in the health sector context.
What should a security department look out for insider threats?
Exfiltration, I think.
Yeah, that's a good question. I'm not too familiar with that side of the house, but I could talk to the people who are and get back to you about that.
Usually it's in the DLP space.
So I think the broker access is kind of one way you can try to control the insider threat from a security point of view. So you can have like more controls around you're not passing any like DLP based policies so that you're not basically preventing the data loss. And you have doing that. Then the North Korean actor, I think that's like a very
That one,
it's a very use case, yeah. Similar.
yeah, that one is more like when they get shipped their laptop for a remote job, they want it suddenly redirected to somewhere else. In Zoom meetings, they never turn their camera on, so kind of prodding. Then there's also I think I'm not sure, but I've heard of certain names that's like this is likely, we've seen this in other people be hiring. But the biggest thing that we advocate for the North Korean remote IT worker is bridging the gap. So having your cybersecurity teams and your HR talent acquisition teams to talk to each other, that way you can, so that they're aware of it. Because by the time that it gets to you, you don't want that person to already be hired. So by making sure that both teams are aware of what's going on, it better prepares the talent acquisition folks to recognize that and be on the lookout for that stuff, especially when recruiting for remote work.
Yeah, on that, I know before we kind of published what happened with us. And that gentleman was on 4 Zoom calls. And so what they'll do sometimes is he used AI to take a stock photo and make it look more like him. So then you compare that with the person on the screen, it looks like them. So they are doing that, and sometimes what we think is happening is they are very smart people that are initially doing the interviews, and or they may have a person off to the side getting any information they don't know for them. But then what they'll do is they get hired and they hand it off to somebody that continues to go as long as they possibly can before they get fired. And again, it's all about getting money back to there. When it comes to the laptops, that's exactly what happened to us. It was like, oh, I'm moving to Seattle. We needed shipped to Seattle, etc. So we saw that. We have heard, and I know this is terrible, but we have maybe heard that if you ask candidates some sensitive questions, that Sometimes they will end it right there, things like, exactly how fat is the superintendent leader? Okay, they don't want to respond to that, right? That's not a good idea, so, I'm just throwing that out there, there are some questions you can ask them like that to see what happens. But what was interesting is, after our situation, when we caught the person and shut it all down, typically, we always request stuff back, so we requested the laptop back, they actually shipped us the laptop.
Oh, wow.
Yeah, so we got it, here we go.
I
They didn't want a bunch of repeat.
And, I mean, it's sneaky what they're doing in
Yeah.
those things, they're using like IVPNs. So it simulates a keyboard and mouse, so it's not like they're RDPing straight into the machine or remoting into the machine. They're remoting into a device that simulates a keyboard and mouse. So it's really hard to see that they're actually remote, pretty interesting.
Yeah, I've seen some news articles about laptop farms
Yeah.
being used with that kind of stuff.
There were 5 Americans busted, it's in Hacker News today.
Oh, today, I
Yeah.
haven't seen that.
5 Americans busted as part of it.
Oh,
Like
wow.
136 infiltrations or something like that. Yeah.
Astral is the one where I've kind of discovered something, Astral VPN, we kind of use that for training.
Yeah.
So,
So this was a little bit of a joke at a hospital that was really bad. And they had said, we've never been breached, and somebody jokes that the hackers are actually running the network. And keeping people out of that infrastructure. Have you seen organizations where you go, this is too quiet, something's wrong here?
So from the ISAC, we haven't heard much about that, but I wouldn't put it beyond the realm of possibility. There's a lot of security events that we don't have insight to, just because we only hear what our members tell us. And a lot of times our members consult with legal to see what they can share, and legal probably would want to keep that stuff closer to the chest.
Yeah.
So it really is kind of a give and take, but it seems like something, if they're already in the network, it seems possible, but it's not something that I can say that we've directly observed.
How about third-party vendors and API security? How much of it is coming in through open APIs and third party?
As far as open APIs, I can't really say, I don't know, but I can tell you that third-party risk management is a huge conversation in the community, which leads me to believe that a lot of organizations are vested in it, which means that they might have some, like Beyond Trust, that was our second most. We're talking about third parties. Beyond Trust would be a third-party software as a service, and that was our second most common targeted alert that we sent out. So it goes to show that we are alerting our members on third parties, not granularity that we know what third parties you have. So if you were gonna have custom profiles for each member, we're not there as an organization. But we are, when we get alerts from our intelligence partners about software as a service vulnerabilities that are impacting members, it does show that there is some third party risk going on in the health sector that we try to address best we can.
I would say one of the best benefits, because we're a member of HISAC, is the IOC sharing. So you have more, as I mentioned, they only know what's shared with them, but through the channels, we end up seeing that, that 10,000 plus security analysts are always sharing information about what they're seeing, and we typically will get it from HISAC faster than any of the vendors. So you get kind of
It's
much more expedient information around, here's the IPs that are targeting us right now, and then everyone's checking their system, hashes, all that sort of stuff, very valuable.
Thank you. I'll pass that along to our, maybe the guy who oversees our cybersecurity automation. He'd be happy to hear that.
You guys partner with Health Alliance where you can see all the third parties that have passed their high trust certifications.
I don't know about that. I'm not aware of any partnership that we have with them. But I can certainly ask the people at my organization, they know more about our strategic partnerships.
But it's not vested on high trust certifications, but they're still being stopped even though they're high trust certified, so it's. Like, what does it mean? It's good.
Can I ask another question?
Of course.
Have you heard of anything where, and I hate to go back to medical devices again, but that's all I know. Where medical devices are pinging out to other countries and trying to open up, dare I say, doors? Are you hearing?
I think I know what you're talking about. I've heard, maybe not so much in the medical device. We have a medical device team at Health-ISAC. Unfortunately, I'm not on it, so I can't give you the best information. But I have heard of IoT devices that have Chinese IPs hard coded into their firmware, so they beacon out for updates. And anything else. But we do have the Medical Device Security Council at Health-ISAC where we put medical device manufacturers and healthcare delivery organizations in the same place so that each can see what the other needs. So a big one is like making sure that there's a way to patch these devices remotely. Because you can't take a medical device offline and patch it without interrupting patient care. So I know that's a big thing that they're talking about right now there, but I would encourage, if your organization is part of Health-ISAC, or if not, we have that capability to put you in contact with those medical device manufacturers. But if not, there are some public facing Health-ISAC white papers about medical device security that might have your answers that unfortunately I'm not as well versed as some of the other folks at my organization.
I had a school system that had a teacher bought a bird feeder with a camera on it.
Yeah.
Plugged it into the network, it lit up the network, started scraping the network and sending them better. So we have a project to stop it, so Project Bird Feeder, of course. So it's not so much, it's the other things that get plugged in.
Yeah.
Yeah.
We had an incident at my company, where I had to tell the, employee, they're not there, get your fridge off this, get that fridge off the Wi-Fi. Like disconnect your fridge please from the Wi-Fi because, we were seeing like traffic coming from her machine. It wasn't her laptop. And I was asking her, what else have you got in your house? Cause I can see it right now, I can see it. Like, and she just kept switching everything off until the fridge was the last thing, and then it was the fridge.
To be transparent, it was a piece of oncology equipment that was trying to beacon out. And, of course, we isolated it and kind of locked off the room to it and took it off the network. But it was, we're seeing an increase of that. And it's something that they're wanting to go very interesting IP address. That it's like, why would you want to go bigger?
Yeah. Well, what was interesting is that the person using the fridge, which was obviously not her, was actually attacking our company's APIs from IP address, which was white, because she was an employee.
Wow. There's crazy stories out there. I'll tell you.
Alrighty, well, I think that ought to do it for this presentation. I got some business cards over here if you want to connect with me and you have any more questions, I'd be happy to answer them, but thank you all for coming out. And
Well done. Thank you.
Yes.
thank you. Glad you invited me.
Yeah.
I want you. That's kind of